So many people come into my office with a worse back or neck because they're getting hot packs or cold packs wrong. So let's have a look at what you should be doing. Most of the pain that we get in our back and neck comes from two things: inflammation and muscle tightness. And hot and cold packs can influence both of those significantly. Ice decreases inflammation. It reduces blood flow so there's less inflammation and painful swelling in the area. Good, right? Well, it depends. Recent studies show that the reduced swelling and healing agents of icing reduces the healing process, increasing healing time for soft tissue injuries. So if you have inflammation in your back or neck from a recent injury or trauma, ice isn't your best bet. You're better off resting it and letting the normal healing process do its thing. But a large percentage of back and neck pain comes from inflamed spinal joints, not trauma. Poorly moving, dysfunctional joint movement, compressing or irritating structures in and around the joints. Nothing's torn or damaged, just jammed and irritated. So ice can do a great job of settling down that joint inflammation. The less inflamed the joints, the better they'll feel and move. How do you know if the spinal joints are inflamed? Well, it doesn't have to look swollen to be inflamed, but the pain will be a sharp stabbing type of pain. It'll be right over the spine, not off to one side, and you'll notice it especially with movement. Here's a good little test to see if your back or neck is inflamed. If you look up at the ceiling or arch your lower back, this movement compresses the joints. If the joints are inflamed, this will often hurt. If you have pain on one side of your back or neck and you lean to that side, that compresses the spinal joints on that side too. So if that hurts, the joints are inflamed. If either of these movements cause pain, put a cold pack on that area. How long should you ice for? Well, the research is a bit conflicted on this, but there's some thought that if things get too cold, the body starts to do the reverse. It increases the blood flow to protect the body from extreme cold. So keep icing time to under 20 minutes. I'd aim for 10 to 15 minutes a few times a day, but leave 30 minutes between the icing sessions to help to avoid that reverse effect. Always make sure that you have a thin cloth between the ice and your skin, something like a cotton shirt to stop the skin from being burnt. More flexible cold packs work better too because they can conform to the shape of your body better. Heat does the opposite. It increases the blood flow, which increases the inflammation. So heat isn't what you want if you've got that sharp pain in the spine, especially with movement. Heat can often feel good at the time because the increase in blood flow relaxes the muscles. But you don't want to increase blood flow if your neck or back is inflamed. But if what you feel is more like tight, stiff muscles, then heat can help to relax those muscles. Again, put a cloth between the hot pack and the skin to stop burning the skin and stick to 10 to 15 minutes at a time. So in summary, if you have sharp pain in the spine, especially with movement, go for ice, unless it's a traumatic injury. If it feels more tight and stiff, especially off to the side of the spine, go for heat. And if you really can't tell if it's from inflammation or the muscles, go for ice or nothing. Anyway, there you go. I hope you liked the video. If you did, please consider liking and subscribing because it always really helps. And let me know how you go in the comment section below because I love to read that stuff. Okay, cheers.